Hi everyone, welcome back. We're going to talk about the COVID-19 vaccine. There's been a lot of concerns about a lack of uptake. There's been articles. I know there's a campaign to encourage mainly members of the ethnic minority community who are in a vulnerable category to take up the vaccine. There seems to be a reluctance. But before I hand over to Andrew, there's been one of the issues that's been brought up is health inequalities in Tower Hamlets. We have one of the youngest population in Tower Hamlets, but we have quite a high mortality rate in terms of health inequality, one of the lowest, life expectancy. And that's shown in the COVID-19 outbreak in terms of the concentrations of fatalities in certain sections, certain demographics, etc. So when it came to the COVID-19 vaccine, there's been a lot of discussion about there seems to be a gap in terms of certain communities are not taking up the vaccine, are reluctant, whereas other communities are not. So without further ado, I'll just hand over to Andrew. And this was discussed at the Overview and Scrutiny Committee in the Council, and that's the committee that holds the mayor to check or questions the mayor's decisions. Do you want to talk about what was discussed in that Scrutiny Committee about the COVID-19 vaccine uptake or the gap in the uptake?
Okay, so Tower Hamlets Council has a public health department because actually we're responsible for local public health, not the NHS anymore. So Dr. Somen Banerjee is our Director of Public Health, and he always gives us excellent presentations about kind of what's happening. And he gave us a presentation last Monday about what was happening in the vaccines. And he gave a report about the uptake of COVID vaccinations in people aged over 80. And he broke it down by ethnic group. And the numbers were, so 71% of white people who had the infection had been vaccinated, had gone and actually been vaccinated. But only 37% of the Asian community had gone to be vaccinated. And only 26% of the Black community, which in Tower Hamlets is mainly Somali, had gone to be vaccinated. So these are people who'd had the text message or the letter to be vaccinated and who had actually attended. And obviously that's deeply concerning because it means that not everybody's actually going to get the vaccine. So when we asked him some of the reasons why, so he thought so familiarity with the process may be one explanation. So he gave the example of flu vaccinations, and he said actually the Asian community actually have above average rates of flu vaccination compared to other communities. So there's something different about COVID compared to the COVID process, I should say, compared to the flu process. Whereas the Black community also have low uptake of the flu vaccination as well. And we can speculate a great deal about some of the different reasons, but I think it's critically important for us to understand the reasons why, because until we get all of our community vaccinated, we're going to continue to have deaths and hospitalizations, which we need to avoid.
Yeah, just speaking anecdotally to people in the area where I live, one of the things that they responded back was in terms of the winter flu vaccine, they got a phone call from the GP kind of ish, reminding them it's that time of the year. When are you going to come in and take it? It's for your benefit, you're in the risk category. Whereas with the COVID vaccine, they just got a text message, which if you're an elderly person, mobile phones have just recently come out in the last decade or so. You get this text message, an unfamiliar text message. You wouldn't respond to that. You wouldn't know how to respond to it because you need some kind of reference as to who this message is from. There needs to be some kind of human interaction, and I think that's one of the feedbacks I got is the way things are being communicated is not the normal channel of how public health or advice is communicated to people. And I know the Observer or someone did an article about Liverpool GPs who had a different approach, and they have one of the highest levels of health inequality in that city, and they've managed to basically improve the uptake. So is it one of approach or communications? Has there been discussions about that, Andrew?
Yeah. So I think that is definitely part of it. One of the other things that Dr. Banerjee suggested as well is actually familiarity with the locations where the actual injections are being made. So for a flu vaccination, you'd nearly always go to your local GP, and people generally know where their local GP is, and obviously it is local. But and I've just been double checking. So a lot of the flu vaccinations, especially in the early stages, were offered, for example, in the Excel Centre in Newham, which is great if you've got a car, as we were just discussing earlier. But not a lot of people have actually been to the Excel Centre and know exactly where it is, and it can be quite tricky to drive there if you don't know where you're going. And then the same with Stratford Shopping Centre again. I've been there a number of times and know where it is, but that's not true of anybody. And I think it's the location of the vaccination centre and people's familiarity with it is also a contributing factor as well. That the more local, the more people know that place, the better.
So who's in charge of these vaccination centres? Is it the council in terms of its public health remit, or is it NHS sort of ish? Who's deciding the locations, so to speak?
It's NHS, and it's very much kind of being top down. But I know in terms of the testing centre, it was very much a kind of combined conversation. So the testing centres are sort of better located, sort of Jack Dash House in the Isle of Dogs, Mile End Park, slightly more controversial, the Watney Street Idea Store. But at least there's places where, a number of people will know where they are. And that was done as a kind of conversation between the council and NHS. Whereas I think for the vaccination centres, and the third one I think is Queen Mary University, I think, but I might be wrong about that. But again, it's not a site that's that familiar to people.
Yeah. Well, it's something to which I know there's a massive communications sort of people doing their bit, but I think we need to look at how we communicate as well. I was having a conversation with someone. I go, look, 80-year-olds or people above the age of 60 are not on Twitter that much. Mm-hmm. So just communicating through Twitter, I don't think it needs to be much more word of mouth, finding stakeholders that speak to like women's groups or elderly groups like luncheon clubs, etc., and try to work through those kind of networks, familiar networks, to basically get people in. Or we have loads of benefit advisory services. Use that to basically people come to them for benefits advice. People will listen to them if they, in terms of a public health message. So we need to start looking at different ways of communicating to different groups, rather than have sort of like a catch-all kind of approach, sort of ish, or just putting everything on social media, because there's lots of people who don't use social media. I know that for a fact. Just interacting, and there's a lot of isolated individuals out there as well who are vulnerable. I've come across it in terms of the food bank. I'm personally quite shocked how isolated some elderly residents are, where the children have gone away for work, like in Northampton or Redbridge, and mum and dad, or sometimes mum or sometimes dad, is just on his own. And so we need to start thinking about how we get to these hard to reach pockets in our community who definitely need the vaccine, sort of ish, who need that prompting, sort of ish. We've got a number if anyone wants to ring, 07852 473 473. That's 07852 473 473. Andrew, where do you think this is gonna pan out? Are they going to come back to you with a new strategy, or is the scrutiny committee going to look into it further?
Well, we've got the Health and Adult Scrutiny Committee Monday night. So I need to get ready for that. So that'll be one of the subjects hopefully we'll be talking about. I know at a national level this is also a concern. So I know Simon Stevens, who's the chief executive of the NHS, was actually talking about this last Wednesday as well. And they're also deeply concerned at the national level. This is not just a Tower Hamlets issue. But I should just sort of mention sort of public announcement. So the council has set up a special helpline for people who need some advice or help on vaccines. and the people, the helpline staff can speak up to 8 community languages. So I'm going to read out the number. I accept that you might not be able to sort of get this, but if you go to the council website and sort of just do a search for vaccines, you should find this number as well. But the number to ring is 0207 364 3030. So that's 0207 364 3030 is a sort of council vaccine helpline number to ring if you need any advice or help. And certainly if you're over 80, and I'd suggest if you're over 70 years of old, clinically extremely vulnerable, an adult care home resident or a health and social care worker, you should have already had the invitation to have the vaccination. So if you want to, or if you know one of the members of those groups, perhaps your parents or grandparents, then they should have been vaccinated already. So you should be chasing on their behalf to get them vaccinated if they haven't already been so.
Yeah, and that same thing, I just want to reiterate, if you know a neighbor, if you know a family member who falls into that vulnerable categories, get them vaccinated. You have that conversation with them, get them vaccinated. They might need a lift or something like that, or etc., or someone to be there to support them. Do that bit, let's go that extra mile and get the vulnerable members of our community vaccinated, because believe me, talking to family members who've had family members in hospital or who suffer from COVID-19, you don't want to wish it on any loved one, etc. That experience of trauma, so to speak, especially when you can't be with them in hospital, etc., and they're isolated. So let's get vulnerable members vaccinated so they don't have to go through that experience. Definitely. But cool. So we're gonna soon go into a break. The next topic is gonna be rubbish collections, or the lack of rubbish collections. I know for a fact my email box has been filled up with rubbish, or people complaining about the lack of